Autism and Eating Disorders. My name is Laurence Cobbaert, and I'm the Chair of Eating Disorders Neurodiversity Australia. All our board members are neurodivergent with lived or living experience of eating disorders. We are passionate about raising awareness of our community's vulnerability towards developing eating disorders and promoting a neurodiversity-affirming approach to eating disorder care. I am autistic and I have lived experience of atypical anorexia. My lived experience of anorexia includes inpatient and outpatient care both in Adelaide and in Sydney, all of which were traumatic due to a lack of awareness and acceptance of neurodivergence within the healthcare system. The systemic issues I have experienced are also experienced by many other autistic people affected by eating disorders in Australia. For example, gender-biased misdiagnosis, patronizing and judgmental attitudes, gaslighting, disregard for the double empathy problem and masking, and unwillingness to make reasonable adjustments with regards to sensory needs and executive functioning differences. Autism and eating disorders. Some figures. Autism is overrepresented in eating disorder populations. Up to 37% of people with eating disorders are estimated to be autistic. However, this might be an underestimate given that up to 80% of autistic assigned female at birth individuals remain undiagnosed at the age of 18 and are often misdiagnosed. Up to 70% of autistic people experience atypical eating behaviors as well as issues with feeding. However, these issues are not all related to eating disorders as such. For example, some are related to movement, such as seen with co-occurring dyspraxia or apraxia, like swallowing, chewing, using cutlery, or sitting up. Autistic people's increased risk of developing eating disorders has been known since the early 1980s. Many studies on this topic have since been published, including systematic reviews and meta-analysis, especially during the last decade. Unfortunately, this body of research spanning decades has been neglected, and awareness of this issue is only emerging among eating disorder clinicians as they are now starting to catch up. Autism and eating disorders. Some considerations. Part 1. Interoception. Interoception is our ability to assess how our body feels from the inside. For example, thirst, pain, fullness, temperature, or hunger. Interoception also involves being able to tell apart different feelings and sensations. For example, am I sad or am I hungry? Am I irritated or am I thirsty? Am I tired or am I angry? Up to 74% of autistic people experience difficulties with interoception, also referred to as interoceptive confusion. Interoceptive confusion increases risk of developing eating disorders. First of all, body mistrust. When you can't fully rely on and become doubtful of your own body signals, you are at a higher risk of having poor body image, and you are also more vulnerable towards internalizing harmful messages about body ideals, such as those conveyed by diet culture. Body signals. When you don't feel hungry, you might forget to eat. When you feel full quickly, you might not eat enough to sustain your needs. When you don't feel full, even when your body has had enough nutrition to sustain itself, you might inadvertently binge eat. Exteroception. Exteroception involves external stimuli. The sensory modalities attached to exteroception are vision, hearing, touch, smell, and taste. Most autistic people, upwards to 90%, experience atypical exteroception, mostly hypersensitivity. Prolonged exposure to sensory overwhelming environments has been shown to contribute to mental health distress such as anxiety and burnout. Atypical exteroception also involves food-related sensory aversions. Forcing or coercing autistic people to eat foods that are not safe for them from a sensory perspective can contribute to food-related sensory trauma. Autism and eating disorders. Some considerations. Part 2. Minority stress, systemic oppression, and cultural trauma. Due to lack of awareness regarding the double empathy problem and wide-ranging lack of acceptance towards autistic people and their ways of existing and being, autistic people are likely to engage in what is referred to as masking. Masking involves hiding your natural ways of socializing and communicating in order to better fit in and avoid being discriminated against. Masking is therefore fundamentally a survival response to pervasive trauma. Unfortunately, masking has been shown to contribute to poor mental health for autistic people, including identity confusion and dislocation, low self-esteem, depression, anxiety, and suicide. Many autistic people affected by eating disorders have expressed that their eating disorder was a form of masking, such as if I lose weight, my social awkwardness won't matter and I will be accepted. Intersectionality. Autistic people are disproportionately affected by immune-related health problems such as hypermobile EDS, irritable bowel syndrome, diabetes, food allergies, skin conditions, and polycystic ovarian syndrome. Immune-related health problems have been shown to increase the risk of developing eating disorders. To non-autistic eating disorder clinicians and researchers as well as health ministers, I call on you to listen to autistic people affected by eating disorders. I call on you to engage in ethical co-production and co-design. I call on you to stop misdiagnosing us. I call on you to show integrity by acknowledging, owning up to, and taking responsibility for iatrogenic harm you cause. I call on you to engage in epistemic humility, self-reflection, and critical thinking. I call on you to do better.